All right, team. So in this video, what we're going to be doing is looking at muscles of the thigh and the upper leg and lower leg. So essentially, we're going to be looking at kind of that last portion of the body, right? Looking at not only anterior muscles of the legs, but also posterior muscles of the legs, talking about those around the hips, and different muscles that are responsible for some of the larger motions that you see in your leg, like flexion, extension, and rotation at your hip. Right, so some of these muscles are actually really big, right? These are some of the largest muscles in the body. A lot of these are muscles that we eat in other organisms. But these muscles are, again, mostly responsible for helping with flexion and extension around the knee and medial and lateral rotation around the hip and flexion and extension of the hip. So those are kind of like the two joints that we're focusing on for this section. All right, so the first muscle that we have here is your sartorius. The sartorius is one of the longest muscles in the human body, and it runs basically all the way across the front of your leg to the inside. So it kind of starts on the outside and goes all the way across to the inside. So this muscle, it's originating on the anterior superior spine of the ilium, so going on like all the way to the rotated far side, and it's going to insert onto the medial surface of the tibia. So it's going to like rotate again all the way around the leg. And so for this muscle, its main job is to help with flexion of the knee. It helps kind of pull the knee from one side to the other, kind of this like band across to bring it in. And it helps with then that lateral rotation at the hip. So when you pull on that, you can actually bring your hip outward by contracting that muscle and like having your hip rotate outward. The next muscle here is your tensor fascia lata. So this muscle, sometimes those of you, if you're like a runner or if you row or you sit in the same position for a really long time, this muscle can cause you some issues and tension. So the tensor fascia lata, its main job is to provide tension for a layer of connective tissue that runs the entire side of your leg. And so this connective tissue, if you've heard of it, it's called of your IT band or your iliotibial band. It's just, or iliotibial tract. Is again just really thick connective tissue that runs the entire length of your leg. So this is going to originate in your iliac crest on the surface of your ilium, and it's going to be between your anterior iliac spine, so your superior and your inferior iliac spine, and then it's going to run that entire length then, just the short bit, into this IT band, so this iliotibial band. The IT band can tear. It's a part that some people have issues with, especially if you have a lot of stress. It can have depending upon what kind of exercises and works that you do. And this muscle can get tense and tight, and it can pull on it so much that it can leave a lot of stress and pain. So oftentimes when people get kind of hip injuries, this is a muscle that can overcompensate and actually lead to other issues down the line. So with the iliotibial tract and the tensor fascia lata, this muscle helps assist with a lot of different things that are happening with your hips. They help with flexion at the hip, abduction, and medial rotation at the hip. They also tense that fascia. That's their job, really, is to like hold that fascia in place to provide you that structural support on the outside of your leg. And they also can help laterally support your knee, like the IT band goes down to the lateral side of your knee that allows it to like then have stability in case you get sideswept or something. It's not going to get like pulled out that way. It keeps it so that you've got some support. But the tensor fascia lata, again, lots of different actions that it can do. Just remember, they're going to be happening around the hip, or it's going to help with support at the knee. The next set of muscles are your gluteal muscles. And so for these, when we're looking at the cat, we're able to see those muscles, but this is an instance, again, where we use the terms for humans on the cats and they don't necessarily match up in terms of size. Okay? So like in humans, the gluteus maximus is the largest one. Well, in cats, it's the gluteus minimus is actually the largest one. So as we're looking at these different muscles, you're going to see that there's a variation in size. But again, their origin, insertion, and action and locations in the cat are going to be the same as the ones here in the human. All right, so for the gluteal muscles, we'll start with the gluteus medius. Again, this is the middle one. It's going to start and originate on the anterior crest of the ilium, and it's going to go down to the surface of the ilium, kind of where it's going to be in the start. So if you're looking at here, think about where your iliac crest is. It's going to be in that underwing, kind of covering then over the hip joint. And it's going to insert onto the greater trochanter of the femur. So again, it's kind of like one of those muscles that's holding on to the femur and keeping it locked into that acetabulum. It's going to Then for its action, it helps with abduction and medial rotation of the hip. So if you're like rotating your hip out and bringing your leg out, that is what your gluteus medius is doing. When we're talking about the gluteus maximus, in the cat, it's not that big, right? But in humans, it's our largest one. It's like our butt. Right? Like that's what you see when you see the gluteal muscle. And so for the gluteus maximus, it's going to originate on the iliac crest of the ilium and actually go down the sacrum and the coccyx. It runs down this posterior side of the hip. So here's our iliac crest, here's our anterior superior iliac spine, the gluteus maximus runs the entire length down here, right, across that, down the sacrum with this really thick aponeurosis of connective tissue, and it goes and it inserts onto the ITBI, right, and the gluteal tuberosity of the femur. So it's going to go to that. We learned the gluteal tuberosity, again, kind of following down from the greater trochanter to the side. That's where it's going to insert. Again, it's going to help with abduction and medial rotation at the hip. So it's going to help pull that back so that you can have that rotation in and out as you're moving the hip. All right, the final muscle in your gluteus trio is your gluteus minimus. So the gluteus minimus will originate on the lateral surface of the ilium. It will insert into the greater trochanter of the femur. So again, kind of where that gluteal tuberosity, greater trochanter are, that's where your gluteal muscles are going to go. And so again, it's helping with abduction and medial rotation of the hip. Again, they all have pretty much the same action. Okay, so again, adduction and medial rotation of the hip. But again, there's structural differences based on where they're originating and how much of that they actually assist. So again, those three muscles will work together to allow for that rotation, but depending upon how much rotation you need, different parts of the muscle will fire. The next set of muscles, we're moving into like the anterior surface of your legs, and we're looking at kind of these larger muscles that assist mostly with extension of the knee. So with your knee, the muscles that help flex are going to be on the posterior side, and the muscles that help extend it are going to be on the anterior side. So with the vastus lateralis, so the vastus muscles, we call them vastus because they're really big, right? They're vast muscles. That's probably not the true root, but that's what I remember. So with the vastus lateralis, you have a vastus lateralis and medialis, and those are both going to run on either side of kind of your femur going down to your knee. So the vastus lateralis is going to be the lateral one, and what it's going to be covering from is the anterior and inferior greater trochanter of the femur, so going down from the femur, and it's going to continue down the linea aspera, so kind of like on that point in the side. And it's going to insert then onto the tibial tuberosity via the patella. So it's going to go down into the knee, attached to that connective tissue in the knee, which then is supported by its attachment at the tibia. Okay. So with this one, when it's working, it's going to contract this muscle here, and so it'll bring, if the knee is flexed, it'll straighten it out. So it'll pull on that tibia and make the knee go straight. So if you're like flexed to the knee, it'll make it go flat. All right, so the biceps femoralis is a muscle that's on the posterior side of the leg. So we've gone to the other side of that. And so with the biceps femoralis or the biceps femoris, either one I've seen, but I like biceps femoris. The biceps femoris is like your biceps in your arm in that it has two different heads, a long and a short. And each of those will pull on different parts of your knee. So they'll kind of rotate around and go to the lateral side of your knee, and they'll help with that lateral rotation as you're moving forward. So it's going to originate on the ischial tuberosity, so it's going to go like from where you're sitting on your butt. Right? Remember that ischial tuberosity is that butt bone that you're sitting on. And it's going to go down to the linea aspera on that posterior side of the femur. So it's going to be running like that entire length there. And it's going to insert, then go around all the way to the head of the fibula. So the top part of the fibula where it meets with that lateral condyle of the tibia. So it kind of runs around the entire back of your leg. And so when you fire that muscle, it's going to have flexion at the knee. You're going to bring the knee up. And it's going to allow for extension and lateral rotation. So if you pull on that, you can feel like your leg, when you think about isolating it, it's like if you're taking your knee and you're like rotating it out like this, okay, that you have that lateral motion. And that's your biceps femoris. Another muscle that helps support with flexion of the knee is your semitendinosus. The semitendinosus is like, again, pulling on this large tendon that's going to the medial side of your knee. And what it's going to be doing is pulling from the ischial tuberosity's origin. It's going to insert onto the medial condyle, so opposite of the biceps femoris. It's going to, again, allow for that flexion at the knee, as well as instead of extension laterally, you're going to be rotating medially, so towards the middle of the body. And that's what it's going to do. So again, flexion since it's on the posterior side. The next muscle here is the gracilis muscle, and this is one of those that, like, it's not, like, the greatest thing to remember, or, like, how do I remember it, but it's useful, and I don't really care. So with the gracilis, if you think about, like, in Spanish, gracias means, like, thank you. Well, it's like, it's the thank you muscle. Like, thanks for touching that. I hate that. But again, if you remember it, that's all that matters. So with that muscle, that's what my college professor did. I still remember it. So with the gracilis, that muscle will run the entire length on the inside of your thigh. And it'll run from the lower portion of the pubis all the way down to the medial condyle of the tibia. And so for that particular muscle, there's a nerve that runs along it, right, that's pretty superficial, and that's why that part of your leg can, if you get hit there, it can hurt really bad because it has that really superficial nerve that runs with it. But also with that particular muscle, it helps assist with flexion of the knee and adduction in medial rotation of the hip. So it's actually allowing you to bring your legs closer together as you're working with it. Okay. But again, your gracilis is a pretty long muscle. It's also it's more superficial. So like your sartorius is going around the front, your gracilis kind of runs down the side of it, and they meet in a similar spot. Okay. These two muscles that we have here, the iliopsoas, which is the iliacus, and the psoas major, these are two muscles that kind of work together. Then this unit that we call the iliopsoas. In the cats, we're going to have a really hard time actually seeing this because we would have to cut pretty deep to see it. But you can get parts of it, especially the psoas that kind of sticks out. As you can see it going over from the pubic bone down and around. So for the iliopsoas, the other reason why I like to point out this muscle is that this is often a muscle that as you get older can get tense. And you have a lot of pressure and issues in your hip. That if it locks up, you'll have a hard time rotating your hip or walking. So it's one that can have a lot of injuries associated with it. So for the iliopsoas, it's going to originate on the medial surface of the ilium, anterior surface, and the transverse processes of your thoracic, last thoracic vertebra and your lumbar vertebra. So it's running from a very last thoracic T12 all the way down to your lumbar. And then it's going to insert onto the femur. So it kind of goes around and inserts kind of behind on the lesser trochanter of that. And so that's going to allow for that fusion to bring it in. And essentially, since you have that attachment point there, the insertion is going to allow your hips to be brought inward. So you're allowed for that kind of medial rotation as well as flexion of the hips. So by flexing that muscle, pulling on it, you're allowing yourself to raise your hip up. So when we do flexion of the hip, if your leg is like this, down, you're flexing, right? And you're doing that. Okay? So that's what's happening with that particular muscle. Another muscle that if you have hip issues, hip pain, you overwork, you run a lot, this is a muscle that you're probably familiar with as one that causes a lot of pain and tension, and that's your pectineus. And the reason why it sucks as a muscle is because structurally in the human we have a place where there's a triangle of blood vessels and nerves that go through, and the iliopsoas and the pectineus essentially smush that if they when they fire. And so if it constantly fires, you're going to have constant pressure on those nerves, and it leaves a lot of, it doesn't feel great. Okay? But with the pectineus, this is going to originate on the superior ramus of the pubis, run around to the inferior portion of the lesser trochanter on the femur. And it's going to help with adduction, it's going to help with flexion and medial rotation of the hip, because again, on the medial side, it's able to pull that in so that your hip is able to bring your legs over. The next set of muscles are all adductor muscles. These adductor muscles are, again, adding the hip to the inside, so they're helping with flexion and medial rotation, but mainly adduction at the hip. So again, use their name to help you understand what's going on with those. So with the adductor longus, this is a long adductor, and it's going to be inferior ramus of the pubis, and it's going to actually go down to the linea aspera on the femur, so it's going to again run down this line on the kind of medial portion of the femur. And with the adductor longus, again, very long muscle. It's one that if you have hip issues or hip flexion issues, it's usually one that doesn't necessarily have a lot of problems associated with it, but if you overwork it, it can lead to pain with the muscle. The adductor magnus, though, is a very, very large muscle. It's, again, it's starting in the same place on your ischial tuberosity and also the inferior ramus of the pubis, and it's going to go all the way down again to the linea aspera and help with adduction of the hip. So it's going to be bringing in that. So this muscle is really wide and large, and we'll see that in the cat. It's the same as it is in the human. That is one of the larger ones. Again, magnus just being big. And so the adductor magnus is what's going to be pulling in your hip so that you're able to rotate your leg medially. So we saw the vastus lateralis. The vastus medialis is going to be running the entire length of your femur. Okay? So it's going to originate on the linea aspera, run that entire length, and it's going to insert again on that tibial tuberosity. Helps with extension at the knee because it's pulling on those ligaments around your patella. So by here, essentially pulling on this ligament at your patella, it's pulling on this that's going to your tibial tuberosity and pulling up your leg. Another one that we saw was the semitendinosus. The semimembranosus runs parallel to that, next to it. But the semimembranosus is a lot longer than the tendinosus, right? And that, there's a lot more less muscle, but longer tendon that's associated with it. And its main job is to help with flexion at the knee, and also helps with extension and medial rotation of the hip. And it's going to originate at the ischial tuberosity, run the posterior side of your leg, and go down to the posterior surface on the medial condyle of the tibia. So it's going to be going down this entire length here to the backside of your tibia and insert on the underside there. So again, when it contracts and you pull on this, it's going to cause flexion at the knee. It's going to bring like kind of the majority of your knee into the back since it's more medially located than the semitendinosus. And so your tendinosus kind of pulls more on the medial side of your knee. This pulls on like the back of your knee. Okay, and you can feel that. So if you feel the on the back side of your knee, you can actually then press on the medial side of that. And you can feel that particular tendon of that muscle as you're flexing. If you slowly flex, you can feel it like pop out. All right, so I know it's a longer video, but there's only a few more muscles left. And these are muscles of the lower leg. So there's a few of those. And these are muscles that are kind of like what supports you if you're trying to walk. So they're important to know. All right, so of these muscles, probably the one that's best known is the gastrocnemius. The gastrocnemius is a superficial muscle in the lower portion of the leg that's essentially there to help support plantar flexion, inversion, and flexion at the knee. So the gastrocnemius, again, superficial and really large, but it doesn't necessarily support a ton of weight. It's actually not so much of a weight-bearing supporting muscle as opposed to just an assisting muscle with the flexion extension, or the flexion at the knee as well as the plantar flexion at the ankle. So its main job is to do that. So it originates on each of the femoral condyles. So there's originates on the left and right of that, and it actually will go down all the way to the posterior side of your leg to your calcaneal tendon or your Achilles tendon. Those are the same thing. With your calcaneal tendon, and actually then kind of go around that part of your calcaneus to the bottom part of your foot. And so the gastrocnemius, you can flex that easily, like if you do plantar flexion or bring your feet, so if your feet are flat like this, you're flexing it down, right? You'll have that flexion and you'll have that experience of what it can do. Okay. The soleus is actually deep to the gastrocnemius. So if you remove the gastrocnemius, there's going to be a couple different muscles that are almost adhered to it, but one of those muscles is going to be your soleus. The soleus is like the sole of your foot, and that is like what provides the most support. This muscle is the one that inserts directly onto your Achilles tendon, and it's going to originate at the head of the fibula and like the top part of the tibia, and it's going to go insert again by way of the calcaneal tendon or the Achilles tendon. And again, its main job, again, supporting with plantar flexion, but adduction of the foot. So it's actually what's bringing your foot kind of in and out as you're pulling on it. And this particular muscle does a lot of that support if you are doing a lift. Like if you're lifting yourself up onto your toes, this is the muscle that's actually doing a majority of like kind of the work of this, the heavier lifting. The last muscles that we're going to look at are muscles that help movement in the ankle and of the toes. And so one of those is the extensor digitorum longus. This is going to be running across the anterior surface of your tibia. It's going to originate on the lateral condyle of the tibia, run all the way down the length of your fibula. And it's going to insert onto the surfaces of your toes 2 through 5. So it actually like inserts and goes all the way down to those distal phalanges of the toe. And so what this allows you to do then is to extend the joints of your toes. So it actually allows you to make your toes go up and out. So instead of curling your toes, like pulling it under, it's actually making it extend. So extensor, extending, digitorum, your digits, longus, it's a long muscle. It runs the entire length of your tibia. The tibialis anterior is another muscle that's responsible for motion in the foot and ankle. So this one we'll see when we look at the tibia, you'll see that tibial crest will poke through like with just bone. You'll see that pretty easily. And so it'll be the most one that's directly lateral to that. Okay? And it's going to run, again, along that lateral condyle, down the entire length of that anterior crest. And it's going to insert at the base of your metatarsal one. So this is the one that goes to your big toe. And what this does is allow for dorsiflexion of the ankle, but also for the inversion in your foot. So like when you bring your feet, if they're flat, and you bring them in, right? This is bring them out, where you're going like this. It's that muscle that allows you to do that. Okay, so that inversion that you're expecting to see. And that's it. Those are all the muscles that we're going to be looking at. So if you have any questions on these, let me know.